Hi everybody, welcome back. So in today's class, we'll be discussing about toxicology. So for the purpose of revision, I have divided toxicology into part 1 and part 2. So in both of these, I'll be covering the most important questions that you need to know from the chapter of toxicology. And usually what happens is that for the actual forensic medicine, around 80% of the mark is allotted and remaining 20% is allotted to toxicology. But at times, what happens is that a lot of questions come from toxicology. So for those who tend to neglect toxicology, that would come as a shocker. For example, for my paper when I was a UG, toxicology had questions worth 20 marks would come, and the maximum that they could score was like 14, 15. Then it was really hard for them to pass as well. Now, coming to the important questions that we'll be discussing today. Under the long essays, we were discussing classification of poisons, describe the signs and symptoms, and management of organophosphorus poisoning. So, organophosphorus poisoning is something that should be there in the tip of your tongue. It not only comes in forensic, it comes in pharma as well. It comes in. So, this is something that you have to know. The next essay is classify insecticide poisons, discuss the mode of action, signs, symptom, and treatment in an acute poisoning by organophosphorus compounds. So in both first and second, they are mainly asking about organophosphate poisoning. So understand how important is the topic of organophosphorus poisoning, okay? And every alternate year, the question of organophosphate poisoning tend to come as a long essay for you. If not long essay, it will definitely come as a shorts or a short essay. The other shorts that we'll be discussing today are antidotes, the management of a case of poisoning by organophosphorus compound, carboluria, plumbism. Plumbism is nothing but chronic lead poisoning. Toxalbumin. What is toxalbumin? It is nothing but phytotoxin. So if they ask phytotoxin, you have to write same things in the line of toxalbumin. We have treatment of snake bite as well as drunkenness. Now, this treatment of snake bite, this entire question on snakes, classification of snakes, treatment of poisoning, what are the different types of snakes, what are the clinical features, and all these can come as a 10 marker as well. And that was one of the 10 markers that came during my UG exam. Now, coming to the app per se, why choose Auricle? Because Auricle is a platform where you have multiple things available to you in a single place. You have recorded classes, live classes, practical session, exam module, and hard copy book set. All of this available to you in a single platform where you can make use of all these resources. Now, coming to the foundation classes are going to offer you a flexible learning atmosphere where you can access these anywhere, anytime, and revisit these topics whenever needed to enhance your understanding and retention of the subject. Okay, and it is also going to be very convenient for the purpose of a revision because here, first of all, every topic, no matter how small or how big, is explained very thoroughly to make you crystal clear with the concepts. And whenever you feel like you've forgotten something, you can definitely go back to these videos and watch them, so that it is going to be an effective tool for revision as well. Coming to the live classes. So live classes are curated in such a way that it is going to give you in-depth coverage and comprehensive classes covering all the important topics, especially the past 10-year PYQs. So what happens is that when you go give your exam just 1 or 2 months before your exam, when you have your study break, this is the time when you're actively trying to study so many subjects, and it becomes difficult for one to complete syllabus if they haven't studied the entire year, and they focus on studying important topics. So where are you getting these important topics from? With the explanation as to how you need to approach and write these answers, it is from our live classes, and these are the most anticipated questions that could come in your exams as well. Then here we not only tell you about the important questions, we guide you through the concepts, answer writing skill. We also give you study plans and so many more. Next, we have the Express exam module. Here, the entire syllabus is covered in less than 20 hours. No matter which subject, forensic, even lesser time is taken. And all the bigger subjects are also covered in less than 18 hours, so that it becomes easy for you to understand the most important topics with highest weightage and focus on them. Here also, we are going to give you high scoring responses. We are going to tell you what diagrams to put in, what flowcharts to include, and how effectively you need to write your answers. We also have the one-to-one doubt clearing session. So in the one-to-one doubt clearing session, as the name suggests, it's a one-to-one. No? So we tend to give you a personalized attention where every student's goal is met here. There are a lot of instances when student has a lot of doubts but fails to ask them in the class, thinking that he might be judged by his peers, or what might the examiner or what might the lecturer think about me. So we are here exactly to help you here. No matter how small or big your doubt is, we are going to cater to your needs, and you can study here safely without any fear of judgment, in a safe learning atmosphere. We also have the hard copy note set. So what is special about Auricle's hard copy note set? It is very colorful. That is why it is going to help you build that picture skew memory, where you can retain things for a long amount of time. We have lots of pointers, flashcards, images, and so many more that is going to help you in your preparation. We also have QBank. So our QBank has 3 levels of expertise. Okay, so initially you go from the beginner level, then you have the next level, and finally you come to the expert level. So always I advise students to start with the beginning level. You set the foundation, and once you've finished it, go to the next level. And finally, when you feel like you're thorough with all the concepts of the particular chapter or subject, go to the expert level. And once you finish the expert level, you are the masters of the subject. And one special thing about our QBank is that it is customizable. That means you can select the questions from whichever topic you're studying from. For instance, if you're studying the topic of toxicology, you can choose questions from toxicology and test how much you've understood. So it's going to be an active recall of everything that you studied for the day. We also cover questions ranging from prof exams, NEET PG up to FMG. We also have practical classes. So our practical classes are designed in such a way that it is going to give you hands-on experience and engage all of you in interactive sessions that are going to simulate real case scenarios. So usually there is a bridge between when practicals happen in your college and when you actually go and give your exams. So in that bridge, you usually have your study break, you have your exams coming up and all that, and you forget what practicals would start. And just before practicals, you keep wondering if at all practicals would start in your college, and did you attend one of those? And to help you dive into practicals and come out of it successfully, we have curated these practical sessions where we try to give you hands-on experience about the real case scenarios. And then apart from this, we are also going to guide you through the Viva OC questions that could be asked, and also about the spotters that can be kept in the exam. So especially in a subject like forensic medicine and community medicine, there are a lot of spotters from each and every chapter, and it becomes a very daunting task for students to go search everything. No? So we are trying to offer you everything in a single platform. Coming to the various subscription plans, we have 4 types of plans. It is a foundation plan, advanced learning plan, complete learning plan, and the ultimate MBBS plan. So coming to the foundation plan, here we have the pre-recorded classes, live classes, express exam module, practical session, and QBank for a period of 3 months. Now in the advanced learning plan, you have the pre-recorded classes, live classes, express exam module, practical, and QBank. The same things for a period of 6 months. Okay. Coming to the complete learning plan, as the name says, it's complete. No? So you are going to get every resource that is there in Auricle at your hands. That is pre-recorded classes, live classes. What next? You have the express exam module, practical session, QBank, you have hard copy notes and one-to-one doubt clearing session. Now, when all of these is available to you for a period of 4 years, that is through and through MBBS, if you're covered with Auricle, it becomes the ultimate MBBS plan, and that is what you have to be taking. And you can use my coupon code Dr Prashi kaveri 20 to get additional discount on your subscription from Auricle. Now, diving into the subject per se, as I told you, we'll be discussing about toxicology. So the number 1 long essay that we'll be discussing today is classify the poisons, describe the signs and symptoms, and management of organophosphorus poisoning. Now, firstly, they're asking you about poisons. So you, even though in the question did not ask you a definition of poisoning, it is always wise to write the definition. So what is a poison? A poison is a substance which could be solid, liquid, or a gas, which when introduced in the living body or brought into contact with any part will produce ill health or death or local side effects. So it is not that you have to ingest it or take it orally to cause a side effect. It could be taking it orally or coming into contact with skin or anything like that, which could cause the side effect. Now, what is the classification? So this is the classification, which for the purpose of exam, you can put it in the form of a flow chart. So that is going to make your paper look more presentable. Okay. So how are you going to put it in the form of flowchart? Number one classification of poisoning is nothing but corrosives. So under corrosives, you have two things. You have strong acids and you have bases. And finally, you have metal salts. Okay. So these are the three things that come under corrosives. Next, you have something called as irritants. So under irritants, you have again three types. So what are the three types under irritants? You have agricultural irritants, you have inorganic irritants, and you have organic irritants. Then you have systemic. So when you come to systemic poisoning, you have different systems. So number one will be cerebral. Next you have CVS. Then you have spinal. Next you have asphyxiant. So this is what you have to understand. Now, in case you have a lot of time, you can give examples for each of these. Now, how are you going to give examples? I'm going to tell you in simple words. Now, for example, first group of corrosives, you have acid. Write two examples of acid. What are the example? You can write H2SO for hydrogen then sulfuric acid, or you can write hydrochloric acid, HCl, or nitric acid, whichever you're comfortable with. For bases, you can give example: sodium hydroxide, NaOH, potassium hydroxide, KOH. You can mention these. Coming to metallic salts, you can give some examples like mercury chloride. These are all the metal salts that can act as poison. Now coming to irritants, you can give some examples. You have to give examples about agricultural irritants, inorganic and organic. What are the agricultural irritants? You can write any plant per se, or you can write about any item that is used in farming or agriculture that acts as a poison. For example, the thing that we're studying in this question. What is it? Organophosphates, organochlorins. These are the examples. Then you have inorganic. What are inorganic? Various compounds, like for example, phosphorus or lead, they come in inorganic irritants. Coming under organic, you have the spider bite, you have the snake bite. So all these come under the organic irritants. Okay. Then the last group is systemic. So under systemic, what are the examples that you can write? Cerebral. Cerebral means having to do something with the CNS. So what are those? These are nothing but what can those be? Alcohol, methanol, ethanol, all these things can be mentioned here. Next, CVS, that is something to do with the heart or the circulation. What are these? You have nerium, odorum, you have so many other plant poisons, or the colorful, beautiful datura, all these. Okay, these are very colorful, and children usually when they see it, they tend to put it to the mouth. But these are very, very poisonous. In one of the important questions, I'll be discussing about these CVS poisons in detail. Coming to spinal. What is it? You have the Nux vomica, which is also called as Cuchilla. This is one of the spinal poisons you have to be aware of. Coming to asphyxiants, you have carbon monoxide, hydrogen sulfide. So these are the asphyxiants. So this is how you need to put a classification, so that the examiner, when they see your paper, this entire classification, if you put it with these many examples, take it from me, it is going to cover an entire page, and that page is going to look so beautiful, so presentable, so much content that you can score out, or at least 9 on 10 for this question. After writing this, you have to go and explain about organophosphorus poison. So when you talk about organophosphorus poison, there are two things. One is allyl phosphate, and then you have the aryl phosphate. So allyl phosphate are example demifox and malathion. There's so many examples, okay, but you need not break your head on remembering everything. Remember one or two important ones. So coming to alkyl phosphates, you have demifox and malathion. Coming to aryl phosphates, remember parathion and chlorothion. Easy, no? They are the rhyming words. Parathion, chlorothion, PC. Okay. Next, coming to the action, it inhibits the enzyme by phosphorylation in the neuromuscular junction and synapses, and inhibits the release of acetylcholine. This is how it is going to bring in the action. So now acetylcholine is not released. So what happens? It starts getting accumulated in the parasympathetic, sympathetic and somatic sites and cause various symptoms. So acetylcholine by itself is going to cause a lot of symptoms. Okay. Now because it is not degraded, it's not given off, it is going to accumulate on all these sites, and it is going to cause all the symptoms. Let us look at what are the symptoms. Firstly, see, this is where the acetylcholine is going to stay. All these squared black color things, these are the acetylcholine. These are there in the vesicles. Now it is released in the junction. Now, after it is released in the junction, what is happening? It is not taken, it is not broken down. So when it is not broken down, there is a lot of acetylcholine which is going and acting on the receptors. There is going to be overstimulation of the receptor, because of which a lot of actions take place. Now, coming to the symptoms, there could be symptoms like muscarinic symptoms, and we have certain other symptoms as well. Now, coming to muscarinic symptoms, you can remember everything with the mnemonic, and the mnemonic is nothing but sludge. Without this mnemonic, it becomes hard for you to recall every point. So remember the mnemonic sludge, okay? So sludge means salivation, S for salivation, L for lacrimation, U for urination, D for defecation, G for gastrointestinal distress, and E for emesis. So what you have to remember is, the person comes to you covered in sweat, is covered in feces, and covered in urine, covered in saliva. So there's going to be secretions everywhere. All the types of secretion is going to be there. So whenever you're working as an RMO or a casualty officer, whenever you see such a person who's covered in his own sweat and feces and urine, there's going to be a peculiar odor. By looking at him only, you can identify that it is a case of organophosphorus poisoning. And what are the symptoms we're talking about here? These are the muscarinic symptoms. Now, after this, we'll be looking at the other symptoms, nicotinic symptoms as well, okay? So, now as I told you, apart from sludge, there are also some other muscarinic manifestations. So, what are those? There is, in the bronchial tree, there is going to be bronchoconstriction and increased secretion. So, whenever there is increased secretions, the airway is going to be kind of blocked. And in order to overcome that, there's a lot of stress and force that is being generated in the airway. And finally, there's going to be bronchoconstriction. In the GIT, gastrointestinal tract, there's going to be nausea, vomiting, diarrhea, and fecal incontinence. Sweat glands, increase sweating. Salivary glands, increase salivation. CVS, that is vascular system, there is going to be bradycardia and hypotension. Pupils show meiosis. Meiosis means what? Is it the bigger pupil or the smaller pupil? It is the small pupil. It becomes very, very small. Bladder is going to be urinary incontinence, because of which there is going to be overflow from the bladder. Understand that everything is going to be increased, no? But when you talk about CVS or the cardiac function, it is going to be slow. There's going to be bradycardia or hypotension that is seen. Now, apart from the muscarinic symptoms, you should also know about the nicotinic manifestation and the CNS manifestations. Coming to the nicotinic manifestations, they are the smaller muscular changes that are seen. All these come under the nicotinic manifestation. So what are those? Muscular fasciculation, cramps, weakness, areflexia. Any muscular symptom that you can think of can be put here. What are those? Muscular fasciculation, cramps, weakness, areflexia. Next, coming to the CNS manifestations, what all do you have here? Restlessness, headache, drowsiness, confusion, slurred speech, convulsions, coma, and death. In the order of severity, you have to always remember. So whenever you have to write about symptoms, no? Now imagine for a question, you know that almost every symptom of CNS is present. Then how do you remember? Always start with the mild one, when the person is active, cooperative, conscious, everything. So he could be restless that time, he could have headache, he could be slightly drowsy, all this. All these happen when the person is in a stable condition. Later, what happens? He's going from the stable to unstable, okay, becoming unstable. That time he'll go through confusion, slurred speech, convulsions and all. And lastly, he'll go into coma and death. This is how you have to remember the order. Now, how do you diagnose if a person has organophosphorus poisoning? Based on the signs and symptoms. As I told you, if you're a casualty medical officer, when you see such a case who's covered in his sweat, feces, saliva, urine, you can identify that it is a case of organophosphorus poisoning. Okay. 2 mg of atropine relieves symptoms without atropinizing. So what is atropinizing? Atropinizing means, see, there is something, usually what you do when you give 2 mg of atropine, normally there is going to be bronchial dryness that is seen in people, okay? But it is not going to be seen in cases of those people who have taken organophosphorus. Cholinesterase level also you're checking, and the enzyme level is significantly reduced. It is less than 50%. So these are the things that you can use in order to diagnose a case of organophosphorus poisoning. After which you have to do the treatment. That is, patient is removed from the source of exposure cloths are removed, washed with soap and water, because you do not want any further entry of the substance into the body. That is why you're going to clean him thoroughly. Then you're going to look at the airway. You almost try to give 100% oxygen so that his breathing becomes normal and his SpO2 is taken care of. You give a stomach wash, and preferably you give it with a potassium permanganate. So when you give a potassium permanganate stomach wash, it is going to remove all the unabsorbed poison that is there in the stomach. You can also give activated charcoal. So it is going to absorb whatever poison is there in the stomach, and that way you can remove it. And when it absorbs, it prevents the further absorption of the poison into the body or the circulatory system. You can give atropine sulfate, which is an antidote in the case of organophosphorus poisoning. And also you can give acetylcholine esterase reactivators like pralidoxime. So pralidoxime is going to reactivate or bring the activity back of cholinesterase enzyme. So remember, you have to give it within 6 hours. Okay, if the patient comes after 6 hours and then you give pralidoxime, aging of the enzyme would have taken place. That is why it is not going to help you serve the purpose. So what are the autopsy findings? Look at the face. Face is going to be congested. There's going to be cyanosis of the lips and fingers. In the stomach, you can see the smell of kerosene. Respiratory passage is also going to be congested, and there is going to be exudates that are seen in the respiratory passage. Coming to lungs, brain, heart, all of these are also going to be congested. In the heart and in the brain, you also see something called as the petechial hemorrhages. So this is what you will be going to see. Now, coming to the second question, here also they're asking you about the classification of insecticide poisoning. They're asking you the mode of action, signs, symptoms, and treatment of acute poisoning by organophosphorus compounds. So even in this question, they're focusing on the OP compounds or the organophosphorus compounds. So you, by now, I think you've understood how important is it to know about the organophosphorus compounds. Okay. Now, coming to the classification of insecticides. In insecticides, you have two types. Number one is natural and number two is synthetic. Okay. Under natural, again, you have two types. Number one is plant-based, then you have mineral oils. So what are the plant-based insecticides? Pyrethrum and azadirachtin. So these are the plant-based. So this pyrethrum and all, it is not a indie brand. Okay, it is brought to India from somewhere else, and now it is being used as a insecticide. Next, coming to the other one, we have certain mineral oils that can act as an insecticide used to kill insect. So this is always remember that oils are enemy of insects. Okay, not only here, even if there is a case of a foreign body in the ear, okay, or nose, for example, not nose, ear mainly, and in that ear, if there is an insects, you don't try to attempt to kill, remove the insects by itself, because it starts flying and stinging and all. There might be other secondary things that could happen. What you do, you put oil so that like a turpentine oil something, so that the insect dies, after which you can remove it. So always remember, oil and insects are enemy of each other. Now coming to the synthetic insecticides, you have two types. You have the inorganic and organic. Under organic, you have the various types. So what are those? Organochlorines, organophosphate, carbamate, and pyrethroids. So coming to organochlorines, you have DDT and BHC. Coming to organophosphates, OP compounds, you have malathion, tamifos, phenethion, dichlorvos, phenethrothion, and primifos-methyl. Coming to carbamates, you have propoxur, bendiocarb, and carbaryl. Coming to pyrethroids, you have deltamethrin, cyflothrin, bifenthrin, lambda, cyhalothrin, and permethrin. So I know that it is very, very difficult to remember all the names. Try to remember two under each. Okay. So the first part of the classification was simple. Firstly, insecticides you would classify into natural and synthetic. Okay, that is the first part. Under natural, you have two things. You have plants and you have mineral oil. In plants, you have pyrethroids and azadirachtin. So these are easy. Then you have mineral oils. Under that, you don't have to write about anything. Coming to synthetic, you have inorganic and organic. Here also, organic is the one that is important. Rough classification of organic is something that you have to know. What are those? Organochlorines, organophosphate, carbamate, and pyrethroids. Okay, after which, under organochlorines, write DDT, BHC. Organophosphate, write two things. What are the two important things? Malathion and tamifos are important and they are easy to remember. Under carbamates, write two things, propoxur and carbaryl. These are easy. Under pyrethroids, you can write deltamethrin, and you can also write bifenthrin. So these are the easier ones. So like this, always whenever there's a bigger classification where you tend to get confused, take your highlighter and mark one or two things whose name is familiar with you, or what you can remember, or every time, instead of, somebody might have told you, if there is a big classification with 100 names given, somebody might have told you, if you read it 10 times, you will remember. But in your exam, when you have read it 10 times, okay, but remember, it's not the only classification that you have read. You have read like 100 classifications. So in the exam, you might get confused and you're like, should I read about it? I'm not able to recall. Instead, try to highlight two things under each heading and remember. That way you can remember in the exam. For a NEET, obviously you need to know everything, but in NEET you have options given there, so that, when you see those clues, you tend to get an idea. But in theory, it's just the questions and nothing else given. Therefore, try to be wise while studying. Now here also same thing about organophosphate. So now this question will be going up a little faster, so it's like a revision for you. Two types. What are those? Alkyl phosphate, aryl phosphate. Example of alkyl phosphate, dimethox, malathion. Example of aryl phosphate, parathion and chlorothion. Okay, so what is the action? There is going to be inhibition of the enzyme acetylcholine esterase, because of which acetylcholine is not broken, and there is inhibition of acetylcholine esterase. So acetylcholine is not broken, because of which its level is going to increase and it is going to cause various symptoms. So what are the symptoms that it causes? Muscarinic symptoms, nicotinic symptoms, and CNS symptoms. These are the symptoms that it causes. So this is the same example. And always remember, when a question about organophosphate comes, no matter 10 marker, 3 marker, 5 marker, whatever it is, draw this diagram. Put a presynaptic neuron stating that a lot of vesicles are present and ACH, acetylcholine, is there inside that. After which you put a synapse saying that acetylcholine is released. Then you put into one side, and one you keep a normal image, one you put a cross saying that acetylcholine esterase enzyme activity is gone. So, and after, because of which is a lot of binding in the postsynaptic neuron, and that is going to cause all the excessive symptoms. You can just do this and put 3 arrows under it. You can do something like this. Okay, after you draw that diagram, you can just put 3 arrows and you can write the symptoms: muscarinic symptoms, nicotinic symptoms, and the CNS symptoms. And in the next page, you can put side headings of the same and explain. That is how you can make your, whatever you're trying to convey, it can be conveyed in a better format. Okay. Now coming to the symptoms, as I told you, muscarinic manifestations are there. So that is given by the mnemonic sludge, SLUDGE. So what are those? Salivation, lacrimation, urination, defecation, gastrointestinal distress, and emesis. If you know this much, enough. So if you want to explain a little more, you can write lacrimation, excess secretion of tears, all that you can add, but this is the base that you have to know. This is the same thing. Remember, every secretion is going to increase, but one thing you have to mention in muscarinic is nothing but CVS function. There is going to be slowing of the heart rate, which is also called as bradycardia. This point, or decrease in the BP, hypotension, this is something that you have to make note of. Okay. Next, coming to nicotinic manifestation, as I told you in the earlier question, most of it has to do something with the muscle. So they are the muscle twitch, muscle fasciculations, cramp, weakness, and in severe cases, areflexion. So these are the things that are seen. And coming to the CNS manifestations, you have restlessness, headache, drowsiness, confusion, slurred speech, convulsion, coma, death. So whenever you write about CNS, what did I tell you? Write from the active, the person goes to little inactive state, and the person goes into death. So when you do this, you can remember more and more symptoms. In active phase, he has restlessness, confusion, headache, drowsiness, and all. In this inactive phase, he might have slurred speech, he has convulsions and everything, and finally he goes into coma and death. So how do you diagnose? Based on signs and symptoms, he'll come to you with covered with sweat, feces, urine, and all that. So you can diagnose. And you can also check for the choline esterase level. So when you check for the enzyme level, it is going to be less than 50%. And you can do one more thing, that is you can give atropine. So atropine is an antagonist of organophosphate. So when you give atropine, how much? 2 mg, it is going to bring down a lot of symptoms without atropinizing. Atropinizing is drying out all the secretions. That won't happen. Okay, so this is how we are going to diagnose. Then how do you treat? You're going to secure the airway. First of all, before doing anything, you have to just remove him from the source of exposure. You change his clothes, give him a wash and everything to prevent further absorption. Then you secure the airway and you give 100% oxygen. Stomach wash with what? With potassium permanganate. You have to give stomach wash and you have to give activated charcoal. It acts by adsorption. So when you do both of these, it prevents the further absorption of the unabsorbed particles of organophosphorus, whatever is there in the stomach or whichever part it is. You can give atropine sulfate, which is nothing but a physiological antagonist of organophosphate. And finally, you can also give a trial of pralidoxim. Pralidoxim is acetylcholinesterase reactivator, but remember you have to give it within 6 hours. But if you give it after 6 hours, no use because aging of the enzyme would have taken place. Autopsy findings is going to be mainly congestion seen of all the organs. Face, stomach, respiratory tree, lung, brain, heart, everything is going to be grossly congested in case of OP poisoning. In face, the other things that you have to look for are the cyanosis of the lips and the fingers. In the stomach, when you cut open, you can feel the smell of kerosene. And all the other organs like the lungs, brain, heart, there's going to be congestion. Plus, there is going to be petechial hemorrhagic spots that are seen. Plus, there could be exudation that is seen when you cut open all these organs. Now, coming to the short question, number one question is about antidotes. Okay, so what is an antidote? An antidote is a substance which is going to counteract or neutralize the effect of poisons. So there are two types of antidotes, universal antidote and physiological antidote. So coming to the universal antidote, it consists of the activated charcoal or the burnt toast, 2 parts plus magnesium sulfate oxide, 1 part plus tannic acid or strong tea, 1 part. Universal antidote is absolutely used now. This is only for the purpose of knowing, okay, there is no use. This is what you have to understand before you study this part. But if you write about universal antidote, you tend to get an extra mark. Therefore, for the purpose of theory, you try to remember. Usually in your MCQs or your NEET, what happens, they try to ask you something that you apply in real life. And because the use of universal antidote is obsolete, they won't ask you now. So what does it comprise of? There are 4 parts, 2 plus 1 plus 1. 2 parts of what? 2 parts of activated charcoal. Or if you don't have activated charcoal, if you are at home, you can also use a burnt toast. So what you have to understand is, whenever there is a case of poisoning and you don't know what to give, this universal antidote is something that you can try giving. In case you don't have anything to do, you can't go to a hospital, at least this is something that a layman can try. That is why you have to know this, okay? So instead of activated charcoal, you can also use burnt toast. Then 1 part of magnesium oxide. Then you can also use 1 part of tannic acid, or you can use strong tea at home. So this is what you have to understand. Apart from this, we also have something called as a physiological antidotes. So what are these? These act on the tissues of the body and produce symptoms exactly opposite to that of the poison. So both these antidotes and the actual poison have opposing action, because of which they compete for the receptors and bring in opposite action. For example, you have to write 2 examples also that will become an important thing in such question. One is something that we studied already. Atropine and physostigmine would be one physiological antidote. Repeat after me. Atropine and physostigmine. Then you have sodium nitrite and cyanide. Coming to the second question, the management of a case of poisoning by organophosphorus compounds. Okay, first what do you do? Patient is removed from the source of exposure. His clothes are all removed and washed with soap and water. When you do this, further exposure is prevented. Then to secure the airway, you can give tracheostomy and you can give 100% oxygen, because of which SpO2 gets maintained. You can give a stomach wash by using 1:5000 potassium permanganate. So that is going to prevent the further absorption of the poison from the stomach. You can give an activated charcoal, and all the remaining poison in the stomach is going to get absorbed in the surface of activated charcoal, and that way you can prevent the further absorption. You can give atropine sulfate. It is going to reverse the muscarinic effects, but not the nicotinic. Give till the tracheobronchial secretion is cleared. So this is the meaning of atropinization. Acetylcholinesterase reactivators like pralidoxim you can give if the person presents with less than 6 hours. If they come late, you can give, but not much benefit because aging of the enzyme would have taken place. And in the autopsy, face is going to be congested, cyanosis of lips and fingers in case of OP poisoning. In stomach, whenever you open, there is going to be smell of kerosene that you can feel. In the respiratory passage, there's going to be congestion and hemorrhagic exudate. Whereas in all the other organs like lungs, brain and heart, even there you can see congestion. In lungs, additionally, you can also see petechiae. In the brain, you can see congestion and edema. In the heart is going to be very thin, flabby and congested. Now coming to carboluria, you have to know two things, okay, whenever they ask you about carboluria. One is carbolism. What is the phenomenon of carbolism? It is nothing but poisoning by carbolic acid is nothing but carbolism. So there are certain local symptoms that are there and there are certain systemic symptoms as well. So coming to the local symptoms, there is burning and numbness of the because of the damage of the nerve endings. White opaque discharge which is painless is formed. So whenever this carbolic acid is ingested, there's going to be a lot of burning in the entire oropharynx, in the throat, everywhere, and all the nerve endings get damaged, because of which there is going to be numbness seen. And in the surface, whichever has come in contact with carbolic acid, there is going to be a white discharge that is formed. Systemic effects. Phenol is a depressant of the central nervous system, any respiratory system. There's going to be cyanosis, alkalosis, and metabolic acidosis seen. So remember, carbolic acid is nothing but, what is the other name of carbolic acid? It is nothing but phenol. So whenever you give a carbolic acid or the phenol, there's going to be depression of not only the CNS nervous system, but also respiratory system. Okay. What is carboluria? That is seen during the times of carbolic acid poisoning, or other words, phenol poisoning. In carboluria, urine is initially scanty. That is, the person excretes a very little amount of urine which contains albumin and free hemoglobin. Color is at first turns green. Initially, it's going to be red, then turns green, and even black on exposure to air. Phenol is oxidized to hydroquinone and pyrocatechol, which causes green discoloration. This is called carboluria. From this question, okay, you need to know one part which has to be there in the answer. What is that? That is phenol being oxidized to hydroquinone and pyrocatechol. Because when you mention these words, hydroquinone and pyrocatechol, the examiners are going to understand that you are talking about the compounds that are formed because of oxidation of phenol. And these are going to give urine green color, which is nothing but, which is seen in carboluria. Coming to the next question, plumbism. Plumbism means chronic lead poisoning. What are the signs and symptoms? There is going to be facial pallor, which is the earliest sign. It looks like anemia. Lead can cause anemia. No, that is meant by this point. There's going to be anemia with punctate basophilia. That is, if you look into the RBCs, WBCs, there's going to be punctate basophilia. And then there's going to be reticulocytosis. That is, there is anemia. So our body is trying to form lots of blood cells, new blood cells. So the reticulocytes are formed more, because from reticulocytes only we get blood cells. No, there's going to be anisocytosis, that is difference in the shape and size of the RBCs. Nucleated red blood cells are also seen. And as I told you, basophilic stippling is seen. And eosinophils is also increased. This is called as eosinophilia. There's something called as lead lines that are there. That is stippled blue line called Burtonian line in 50 to 70% of the cases. That is, I'll show you what a lead line looks like. See, if you see the teeth, the gums here, this part of the lower jaw gums and here the upper jaw gums, which show this bluish blackish discoloration. Now, this is nothing but the Burtonian sign, which is seen in cases of lead poisoning. Okay. What are the other signs? There is colic or constipation. Colic is very severe, and colic is nothing but severe pain, churning like pain, usually seen at night. And in some cases, there could be lead palsy. Okay, lead palsy is seen in 10% of the people, where there are tremors, numbness, hyperesthesia, and muscle weakness that are seen. And there is going to be a wrist drop that is seen. If you look at the wrist, there is going to be drop. Wrist is going to look like this. This is a classical wrist drop that is seen in cases of lead poisoning. Then you can also see encephalopathy. It is common in children. There's going to be headache, insomnia, visual disturbance, irritability, hallucination. These are all the vague symptoms, okay? But the specific ones like the wrist drop, colic, constipation, Burtonian lines, these are the things that an examiner will actually expect in your answer. In the CVS, there is going to be hypertension and permanent arterial degeneration seen, because of which there is going to be hard arteries causing hypertension or increased BP. In the reproductive system, menstrual irregularity is seen. There's menorrhagia, dysmenorrhea, abortion, and sterility seen. That is, remember that in lead poisoning, the reproductive system is affected not only in female but even in men. Menorrhagia, increased bleeding, dysmenorrhea, painful menstruation, abortion, sterility could be seen. What is the treatment? You can give BAL, British anti-leukocyte. How much? 4 mg per kg can be given every 4 hours until the blood levels of the lead falls below 40 microgram per 100 ml. Later, you can give D-penicillamine in oral route. So, 2 things. What are those? BAL, BAL, IV, followed by D-penicillamine orally. Coming to the next question, it is about toxalbumin. What is the other name of toxalbumin? It is nothing but phytotoxin. So toxalbumin refers to a group of toxic proteins found in certain plants, such as resin from the castor bean plant. So basically, remember that all the plant poisons, phytotoxins, are nothing but toxalbumin. One of the example is that of the castor plant. We get the resin. So what is the definition? Toxalbumins are a class of proteins with toxic effects. Obviously, no, in the name only you have toxic effects, often derived from plants or seeds. What is the mechanism of action? They work by inhibiting the protein synthesis within cell, leading to cell death. If protein synthesis doesn't occur, the S phase of the cell cycle is going to be hampered, because of which there is going to be cell death. So what are the sources? Common sources include castor bean plant, that is in the form of resin, abrus plant, abrin, and other seeds. There's so many other plant poisons, okay? There is Nux vomica, there is, ricinus, and then there is castor plant, and there are monk's hood, so many, okay, which can act as spinal poison, cardiac poison, and all. We'll be discussing about all these in the coming chapters. What are the symptoms? Ingestion of the toxalbumin can cause nausea, vomiting, abdominal pain. So remember that the GIT symptoms are the superiorly seen symptoms. Nausea, feeling of vomiting, actual vomiting, abdominal pain, and organ failure, depending on how much is the level of exposure. Does these toxalbumin have medical use? Yes. Some toxalbumins like resin are studied for potential use in cancer treatment or as a bioterrorism agent due to their potency. So these is the medical use. What are those? For the cancer treatment as well as bioterrorism. Coming to the next question, treatment of snake bite. So this is also an important question that you have to know of. So one assignment for all of you is to go back to the chapter of snake bite, read about the classification of snakes, okay? There are elapidae, there is hydropidae, there are 3 types of snakes, okay? Myotoxic, then vasculotoxic, and then neurotoxic. Read about them, read the example of the snakes, and see the clinical features that occur in each of these. Then read about how do you differentiate poisonous snakes from the non-poisonous snakes based on the appearance of the snake, as well as the fang marks, size, tail, all those. That is also important. Then read about clinical features seen because of snake bite. Then read about treatment of snake bite. Then read about the polyantivenom. So these 5 things I want you to do today only because it is very important. Okay. Firstly, how do you treat snake bite? Firstly, you have to reassure the patient, because a lot of people, they are very fearful. Okay, when a snake has bitten them, they're very fearful. All your sympathetic system is going to be very, very active, because of which a lot of ill effects could occur. Then you examine the site of the snake bite and try to decide whether it is a poisoning or not. If it is a poisonous snake, usually only 2 fang marks will be present. In non-poisonous, entire set of teeth is going to be seen. After which you're going to immobilize the affected limb. That is, you're going to tie something to it and make sure that the limb is not moving. You are going to immobilize the affected limb. Then you are going to tie a tourniquet in order to stop the venom absorption. And where are you going to tie the tourniquet? Imagine this is a leg of the person and there is a bite somewhere here, okay? So where are you going to tie the tourniquet? You're going to tie the tourniquet proximal to it, near the surface of the body. You're going to try. And how much should be the force at which you tie the tourniquet? Just enough to obstruct the lymph drainage, not the venous drainage. Because if the venous drainage is obstructed, then there can be ischemic gangrene that occurs. So your aim is to just obstruct the lymphatic flow. Then you give a lot of supportive treatment. What supportive treatment? You open an IV line and correct the fluids. Okay. Because a lot of blood loss is also there. No? So you give IV line, correct fluids and electrolytes and acid-base balance. In all the cases of the snake bite, either poisonous or non-poisonous, we have to give broad spectrum antibiotics. Why are you giving antibiotics? In order to prevent the local bite site infection, you're going to give antibiotics, and also you give anti-tetanus serum owing to pathogens found in the snake mouth. So you give the anti-tetanus shot and antibiotics. What is a specific treatment? You give antivenoms, and antivenoms, there are two types. Okay, you have the monovalent antivenom and the polyvalent. What is this is meant by monovalent? That is, they are effective against only a particular species, whereas polyvalent means they are effective against a range of species or several different species at the same time. Usually, whenever there's a snake bite case and we do not know what the snake is, we try to give a polyvalent. Okay. What is the dose? Depends on the severity of the bite and not age or the body size. So by looking at the bite, you're going to decide how much dose you're going to give. Okay. And for the kids, pediatric and the adult dose is going to be same. If it is a mild bite, that is very small bite, nothing, one lot of disruption and all, then you try give 3 to 5 vials. If it is a moderate bite where there's tissue displacement, a lot of oozing, a lot of bleeding, then you give around 5 to 10 vials. If it is a severe case, then you give around 10 vials. And even if you want more than that also, you can give. This is what you have to remember. Now, there's also a question on drunkenness. So what is drunkenness? That is, impaired judgment and coordination is going to be there. Drunkenness affects the brain's ability to process information, leading to poor decision making, reduced reaction time, and loss of physical coordination. Drunkenness means the person has had an amount of alcohol which is going to hamper his thinking, activity, physical, signs, symptoms, everything is going to be hampered. And when he drinks that level of alcohol, you tend to tell the person is in drunkenness. That time, all his judgment is hampered, coordination is hampered, the brain's ability to understand information, to take decision, everything becomes very poor. And the reaction time, something happens, the way he has to react, even that time goes down. There is no proper physical coordination seen. What are the physical symptoms that are seen in person who is drunk? Slurred speech, stumbling, red and glassy eyes, and a flushed face. This is how you can identify a person who is in drunkenness. In extreme cases, it can lead to vomiting, blackouts, or even alcohol poisoning. What are the emotional changes seen? Alcohol can amplify the emotions, causing some individuals to become more outgoing, happy, confident. Imagine the person is very silent to himself, not talking much. Now somebody has given him good dose of alcohol, and now he becomes fully vibrant, so outgoing, such an extrovert. So all these, the alcohol has power to do all these to people. Okay, you can also experience mood swings, anger, or even sadness. There could be short-term memory loss as well. That is, excessive drinking can lead to blackouts. That is, imagine the person is drunk, he's passed out somewhere, and next day, if you try to ask him about what happened the previous day or does he remember anything, he doesn't. He may not have any information or any knowledge of what happened whenever he has drunk so much and has undergone a blackout. Okay, he cannot recall any events which occurred when he was intoxicated. What are the other things that you can see? That can be certain legal as well as social consequences because of the same. Public drunkenness or inappropriate behavior while intoxicated can lead to legal issues, strained relationships, and even social embarrassment. So when a question about drunkenness comes, this is what you have to explain. And these are in very general ground, so you can easily explain about all these things. So these were the questions which we discussed in the first part of toxicology. There is also another class on toxicology, second part, where we'll be discussing about some more important questions from toxicology. Make note of these questions and remember the assignment that I gave you and try to find answer for these. And just before going to your exam, you try to touch upon all these topics because these are very important. Apart from this, there are certain named signs in chronic poisoning cases with metals, like we discussed lead. No, there is also some other like phosphorus, phosphidro, and all that, which is important. This is in acid poisoning, you have to know about H2SO for hydrogen sulfuric acid poisoning, because if there's any other poisoning from acids also, you can write the same points. So these are the things that you have to make note from the chapter of toxicology and poisoning. I hope you enjoyed the class. I will see you all with one more class. Thank you.